Care Queen Brenda here. People with mental health conditions come onto hospice all the time. In fact, I would say it's quite common. These conditions can be acute or chronic. Some of these conditions are depression, anxiety, substance abuse, self-harm, suicidal thoughts, or hopelessness. Other mental health conditions such as bipolar disorder, schizophrenia, or obsessive compulsive disorder, OCD, are also quite common. The hospice philosophy embraces a whole person approach, meeting individuals where they are without judgment and addressing their needs with a compassionate team-based approach. Our goal is not to fix anyone, but to ease pain and discomfort in all forms, physical, mental, emotional, spiritual, as they navigate the final stages of life. Mental health in general is an issue that needs to be given much emphasis so that a patient holds up their dignity and sense of peace in their last days. For some, anxiety and depression are new and a natural response to the reality of facing end of life. For others, mental health challenges have been a lifelong struggle, sometimes managed with treatments, sometimes not. Both experiences are valid and compassionate support is essential in both cases. Whatever your mental health condition is, hospice approaches the start of care for individuals with an integrated team approach. The hospice social worker is trained in mental health counseling, providing emotional support, guidance, and resources to patients and their families. They help navigate the emotional, social, and practical challenges that come with end-of-life care, ensuring that both patients and their loved ones feel supported and understood. Chaplains are versed in the spiritual realm, but they are also experts in helping patients find meaning and legacy in their lives, even when they can't see it for themselves. Hospice bath aides often develop a deep and meaningful connection with patients. After all, assisting someone with bathing is an intimate and personal act of care, one that goes beyond physical needs. It fosters trust, dignity, and comfort, creating moments of connection that can be incredibly meaningful for both the patient and the caregiver. Your hospice nurse collaborates with the hospice doctor to develop a care plan that provides the greatest benefit based on your medical history and past medication use. Hospice doctors also recognize the value of working with a patient psychiatrist, especially when the psychiatrist has been involved in their care for years and knows them deeply. In fact, if your mental health diagnosis is separate from your hospice diagnosis, you can continue seeing your psychiatrist and Medicare will still cover those visits. Personally, I find that I learn the most from my patients who have faced mental health challenges. Seeing them at the end of their lives gives me the privilege of witnessing their resilience, their struggles, and the ways they have coped with profound suffering. In my experience, these individuals tend to be remarkably authentic and honest, offering deep insight into what it means to navigate life's difficulties with courage and raw truth. Click the link below to get a copy of our booklet, The Hospice Care Plan, helping families and caregivers safely and effectively care for the hospice patient.